We need to be change agents coming out of this discussion, including the 70 or so or whatnot online, so that we can truly make the impacts that we need to. I don't have any disclosures. I was asked to mention that. So for those that don't know us, again, I've been at this about 23, 24 years, so a little bit much less than Dr. Bullard. But the mission and the work of the Children's Environmental Health Network has and continues to be a huge passion of mine. As long as children are still born into, unbeknownst to them, families, zip codes, communities that are making them sick, totally limiting their benefit and their ability to be nurtured to their full development, I will be a passionate advocate for this. So we lead what's called the Children's Environmental Health Movement. We're a national nonprofit. We got our start out in the Bay Area, not surprising, for the late 80s. I'm the third director in line. We moved to Washington, D.C. in 2000. And at that time, the director who hired me, fresh out of grad school, thought that that's the place we need to be for the center of policy, but also, being based there. So we are part of academic research. We stimulate the research. We coordinate the NIH Children's Environmental Health Translation Research Centers in the country. And we are the liaison working to translate the science into meaningful public health action, child protective policy, which takes a very long time, right? Federal policy, you can count on your hand, even those that mention the word children. And vulnerable populations to that extent. As Dr. Bullard said, many of them are not, in my humble opinion, very effective, and they certainly are not doing what they were said to do. So a lot of our work is in translation, education, a wide variety of audiences. We started out training healthcare professionals. They thought that was going to be the only real need, train healthcare professionals, pediatrics, get them out there, people trust their doctors, generally speaking, we'll be done. Well, they realized the environmental justice community needs to be talking to farm workers need to be talking to policy leaders, scientists need to be talking to all the above. And if you will, that's history. So we are a leader in climate change in children, and really the nexus between justice. I don't see enough of this being discussed. Dr. Bullard's talk should be everywhere, right? And that the intersections between our most vulnerable, women and children globally, are the most impacted by the impacts of climate change. And climate change exacerbates all of the environmental hazards that we are concerned about. We have a variety of advisors that advise us. We have a science committee, an education committee, a climate justice committee, and we also provide a lot of leadership. We are that go-to group. How will said policy, standard setting, proposal impact children? We're still asking those questions 30-some years in. I call on ancestors all the time, and this one is here from Nelson Mandela. There could be no keener revelation of a society's soul than the way that it treats its children. So let's keep that in mind, right? We have never really in the United States put the health and well-being of children first. I'm going to challenge us to consider, all of us should be challenging ourselves, what if we totally flip that paradigm? Not the paradigm that's set up for the adult healthy male and what they can sustain, but what can the most vulnerable children being one of those populations and the most vulnerable of our children sustain. So again, we've heard from yesterday and today, children are living in this toxic soup, right? That is unfortunate. Again, they don't plan on this. They haven't asked for this. They're born into the situations they're born into. They go to the child care, if they're lucky, in the K through 12 schools that they are able to. And unfortunately, those places are causing them harm. We know that globally, 1 in 4 deaths among children younger than 5 are associated with polluted environments. That's non-disputed, right? So what are we now doing, right? We are very much at this very critical window. We have 6 years, 2030, to reduce U.S. dependency and production of fossil fuels by at least 80%. We're not the only one, but we are leading, #1. It's not exactly the best list to be on. It's Norway, it's Canada. There are others on that list too, Japan. And all countries are doing better, I should say. All of us have been reducing, but we're not on the magnitude of order. So again, this is just a few examples. All the places where children spend their time, their child cares, where cognitive learning is happening at the most rapid rates, their K through 12 schools, certainly their homes. So most of us are spending a lot of time in our built environments, unfortunately, and that is also the case for our children. 24 million homes have lead-based paint. That's the oldest children's environmental health issue still. And we still don't have a handle on that. We have reduced it significantly. Public health standards and policies do work. Safety laws for child seatbelts work, right? But if we also don't go to the finish line, as Dr. Bullard said, what are we doing? We're just allowing still the highest risk of children to be exposed to lead, of all things. During the COVID pandemic, I went through a very emotional experience with my friend and sister, Jackie Patterson, with the Chisholm Legacy Project, who is the founder and executive director of this amazing nonprofit named after Shirley Chisholm, who was our first black elected congresswoman from New York State, and also the first black individual to run for president of the United States. So just some interesting facts. But we wrote this, Racism That Appends the Cradle, looking at how this endemic, so the COVID-19 pandemic, how disinvestment in communities and how climate injustice continues to impact all children, but really drilling down to black and brown children. I invite you to read this. We don't want to stop here, and what we did was a whole review. We didn't have to do new research. We just reviewed what was already out there, lived experience, documentation, people speaking their own words, a bunch of data sets that are out there. So prison, school to prison pipeline, redlining, disinvestment in communities, certainly disinvesting in our schools. When you look outside the US, there is a total difference in many regards. Even developing countries at times do so much better. Putting children first, putting their education first, and inevitably their health and well-being. No one's perfect, but there's a lot of benefit that we can gain even looking outside of our borders. So again, toxic race in the United States, and many of our environmental justice leaders, Dr. Bullard, Peggy Shepard, who helped mentor me for years, Dr. Beverly Wright, Damu Smith, we could keep going on, have made it very clear that children, especially black and brown, indigenous, tribal children, tend to find themselves living and exploring their worlds in much more polluted environments, substandard housing, substandard learning environments. We know that over 40% of school-aged children and adolescents have at least one chronic health condition. Years ago, we used to be talking about infectious illness. Now it's the chronic diseases. 34% increase in childhood cancer since I've been born in 1975. That is not genetics. There's something else happening there. And by the way, it's not tobacco, it's not, lifestyle, it's not alcohol, that a 6-month-old is diagnosed with a lymphoma. 10% of school-aged children in the US have asthma. That's pretty much been standard since I've been in grad school, over 20 years ago. We can't get a handle on this. It's multifactorial. Stress, nutrition, as we heard, there's a lot of factors, but the environmental components, the air pollution, the fact that children can now have diagnosis of asthma just by their proximity of where they live to a high thoroughfare, is a problem. What about autism? I remember sitting on a lot of advisory committees at the NIH where there was it was a discussion and a dispute about, is autism really happening more, or are we better at diagnosing it? At the end of the day, it's both, but it certainly is happening more. And again, it has an environmental component to it. So again, we get muddied down in these details. The urgency is right upon us. Communities need help now. So this slide is unfortunate. I use it all the time, but this is what I'm trying to work on. This is what we should all be trying to work on. This paradigm shift did not happen overnight. All of these health-related chronic illnesses that children are suffering from, research out of the NIH and the National Institutes of Health and many of our research bodies have shown us that at least 25 to 30% of these chronic illnesses have an environmental component to them. It may not be the only reason, but it's a part of the picture. And if we're not driving with that, and we're not including them in every single model, well, yeah, we're constantly going to be finding this. Huge learning disabilities increase of over 200% since we've been keeping track. Well, if you're a child that's trying to focus in school, it's not just lead anymore. It's pesticides, it's neural developments. If you can't focus, you're mislabeled, you're sent into another, proximity of school, you're going to lose interest. No wonder our high school dropout rate is the way it is. It's a combined multiple effect, but if you're not already well as a child, your trajectory is so much harder. Then, of course, I'm not trying to bring us down. I'm going to bring us down before I bring us up, right? So the climate crisis. This is the big elephant in the room. Again, we have 6 years. Now, these are the same methods and stories and examples and cries that have been going on for years, and now here we are up against this serious deadline. And I say often there may be no greater threat to children's environmental health than that of climate change, because it creates the umbrella for all the other drivers of environmental injustice that we're also following. And again, it's not in isolation. It's on top of, as we've been hearing, Dr. Bullen and our leaders, it's a range of oppression and racism and tactics and inequity. So if you're already dealing with food apartheid, again, very distinct decisions for suppliers and grocers to not come into communities. So what are you doing? You're sucking dry that community. A bodega is not a place for fresh food, right? So even in the places like New York City, there have been documentaries where elderly women have to get on 4 or 5 buses just to go find a source of fresh foods. Housing insecurity, employment insecurity, healthcare insecurity. What about childcare and school insecurity? If the COVID pandemic hadn't taught us many things like it did, people need quality, affordable, safe childcare. Many people don't even get that benefit of having their child into childcare. How do you then go to work? Many stories we heard during the COVID pandemic of parents, single families, mothers who had to make the decision of going to their frontline job or losing their job and leaving their young children at home because they couldn't afford, or the childcare closed and has yet to open up. So blending into what we're talking about here today, Exposome research does strengthen scientific basis for policy development, for sure. And it's very good that we're having this discussion, and we have to go further about being very specific about how we get there. So we need to show added value for public health as far as improving communication of research results to non-science audiences. We struggle with this, right? My training is in public health, maternal and child health. I also have a science background. I'm just gonna say we struggle with this. How do we take very nuanced information and combining it with lived experiences to tell the story? Storytelling is a huge asset. Telling the story to policy leaders, media, other multidisciplines, engineers, they have to see the benefit in what we bring to their discipline as they bring to us. Targeting and integrating research into the broader landscape. This is our constant challenge. It is not easy, or it would have been done already. Drawing applicable conclusions and urgently. So the point about always needing more research, that may be true, but in the meantime, we can be moving on research available that has been available right now. We need the political will to do that. So we also need to take a minute and define what am I talking about when we talk about policy. There's many layers of this. You could be giving guidance to policy direction and standard setting. You could be giving recommendations to what ends up to be child protective policy, and then it's the final legislation, which takes long. But our states have been moving. Our states have been moving a long time. So we are not waiting. A lot of our partners have left the federal space. They're frustrated, right? We are not going to leave the federal space. We're out on Capitol Hill physically for a reason. So we're trying to move federal policy in any angle we can, but we're not going to forget our states and our local localities as well, which are moving much quicker. So finding our entry where we can. Let's do it, right? It's happening. There's model approaches that are working. It's not going to be one size fits all, but why would we start from the beginning? Why don't we take advantage of what's been happening in different parts of the country and bringing it into our discussions with policy leaders? It's important to consider that many factors that affect the translation of science into policy has to include public media pressure, economic interests, and political agendas, right? That is the elephant, again, in the room. And to act like it isn't is going to, not support our ambitions. So we have to be ahead of these. So the Exposomics project that was funded in the European Union to look at developing novel approaches and the assessment of environmental exposures and environmental pollutants had some of these summaries. That current regulatory standards and policy not yet are adopted for the use of exposome research. So how do we make that happen? That there is a conceptual framework that is needed for integrating the contributions that we all are working on, including lived experiences and an assessment amount of data that's already available, and external pressure data into models of disease. Effective communication, you'll hear that from me many times. We have to effectively communicate. Everyone defines this differently, but at the end of the day, is what I'm saying to you getting in so that you are going to do something with it. And it's going to be different. Our modes of communication have to be flexible, and that's also something we're not trained for. We're usually trained to get up, we talk about our science, we talk about our data, we talk about our stats, and hopefully it's received. Many times I can tell you it's not. Demonstrate the utility of exposome research to funders. I haven't heard much about capacity and funding. As Dr. Bullard said, we are not following the money, but we do need money to also get a lot of this work done. So that while the money is out there and out there for the taking, let's make sure it's being directed in the ways it needs to be at the community level, led by community priorities, obviously with the contribution of science, lived experience, public health, engineering, city planning. This is the type of paradigm that we are looking for. So there are challenges, of course. Policy development is typically slow. And especially for our rising leaders, they're very frustrated. My older kids are very frustrated, right? Well, it just seems so illogical that we've even gotten here. But that doesn't mean that we slow up the process. We know that those processes can get bogged down. We know the tactics. We've seen them before, right? Well, impact the speed of which novel approaches and data from exposome research be accepted for translation into policy. That is where we are the drivers. That is where people, it is so impressive to see when you go to talk to a legislator at the state level, the federal level, there's a lot of impressed folks when they see the MDs, the PhDs, and again, to go in together with a one unified voice, community leaders who know what they're talking about, K through 12 teachers, principals, who are also talking about their lived experiences in their schools, the amount of learning disabilities that their staff is struggling with and they're not equipped to handle. Constantly trying to put a Band-Aid on these issues and not going further upstream. We have the stories. We need to pull them together. So here's a couple of case examples. So in built environments, humans spend, again, 90% of our time indoors. So the indoor environment is extremely important in these discussions. So an engineering perspective in this study looked at advancing the understanding of factors that shape the built environment exposome and the influence on human wellness and disease. So simultaneously, they were looking at informing the development of a framework for intentionally controlling, not haphazardly, the exposome to protect public health. So here's one of the displays that they came up with, right? So nothing too earth-shattering here, but the point is they then took their lessons learned and started bridging it with other disciplines to actually mobilize action. So a lot of us are already doing that, but the peer-reviewed literature continues to support. We don't have to stop here at just the publication. We have to go further in getting information out to those who are trying to mobilize standard setting. Another example is in childhood obesity. So this study looked at exposome approach to identify actionable risk factors to childhood obesity. Again, many multifactorial implications. They were just looking at some of them. So they examined the different dietary patterns and risk factors for childhood obesity and overweight diagnosis, and that's considered the external exposome. And then they investigated internal molecular changes through epigenetic studies, and then the connection between those two was a very intentional step in this study. So then the results, not too surprising, limiting in the case of these folks that were studied, the intake of ultra-processed foods, which kept showing up constantly in infancy and also in prenatal exposures, moms, and childhood by limiting the proportion of calories they represent in diet. And then there were these other recommendations, diversifying children's diets, emphasizing fresh foods, getting folks out to have physical activity. What also was not discussed that I think we would bring in is, well, there are many challenges to even getting to these goals. And how do we take advantage of not just kicking the can down the road and saying more research is needed, but taking advantage of lived experiences and already existing data sets that show us there are challenges in certain communities with kids going outside and playing. How do we get to that so that it isn't just stopped at that point? So we need to look at developing and standardizing methodologies and technologies for assessing the external and the internal exposome and working and marrying them together, as Dr. Buller was saying. Improving data sets and sharing the integration and being intentional about demonstrating the value of this integration and the added value of exposome science over conventional approaches in answering priority policy and public health standard questions. So we need to translate evidence into policy, and that requires us being well organized. I feel that we can do this. I'm fully committed that we can do this, but we've been working in these silos. Funding happens in these silos. We need to be intentional about letting funders know we're not going to accept the money. We were saying this morning, Dr. Bullitt, if you're not encouraging us to cross across our disciplines, if you're not encouraging us to go the extra mile and do something with the data that we then work so hard to generate with our communities. Engaging with other groups that have an interest in protecting environmental justice, public health, and environment, and avoiding those that don't. We don't have time to waste right now. So better linking with policy making. So that means we have to be talking to policy leaders. How many of you have an active set of relationships with any policy leaders in your vicinity? Right? And it's uncomfortable. And some folks, I hear a lot, we've done advocacy training for scientists and researchers, and a lot of them say, look, I'm just trying to do my science. I didn't really sign up to talk to media and go on CNN and talk to legislators, and that's fine. But many more have an interest, they just haven't had the tools and the support to do it. A lot of us are out here, we're all working through this together. The most important thing is that you show up in the way that you want to show up together in community with the teams that are all singing the same tune. We have to be talking to our policy leaders, and we have to listen to them. What are the questions they have of us? How can we better pull our communication better together for them when the staffers are going and making the cases to their bosses, the bosses are going in and going on votes and appropriating budget or not. So it's a whole process, but we are a big part of that stimulus. We need to consider from the stage of design how study results can be relevant to and presented in a way that can be integrated into the regulatory decision-making framework. So again, there's regulation, there's litigation, there's legislation. All of them are different processes, and all of them have room for us. So we need to have improved exposure assessment. We need to enhance and specify the actions that we are asking for to remove environmental hazards and be very explicit about that. We need to identify subgroups of risk and make sure that we are putting them first. We've never done this. Again, a new paradigm of putting children and the most vulnerable at first of all decision making. We need to enhance prediction and prevention of disease by early intervention. We need to monitor the results of policies in reducing exposures. Primary prevention is our aim constantly. And we need to clarify new hypotheses on the role of environmental justice in public health. So, the importance and relevance of exposome research needs to be incorporated into the development of interventions targeting the population level to improve public health and justice, bottom line. Now, it's the hard work of rolling up our sleeves of how we plan to do that. So some of the ways we at the Children's Environmental Health Network have been and continue to do that is in the climate justice space. Again, that nexus between children's environmental health and climate justice. So we're a founder in the Climate Equity Collaborative, and we're trying to, again, make sure that the child health side of this, the impacts of climate change to children, are not lost, and that we're leveraging existing programs that are already doing great work at a local level but need to have leverage and have more attention and more money to replicate and do the work that they're positively doing to benefit the health of children, to reduce the impacts of climate change, and to mobilize and move towards more of a justice situation. So we're elevating available information. We're elevating the children's environmental health movement, elevating 3 decades of work that we already have in this field to then drive investment. We're trying to get private investors, not necessarily our government, to invest, the sustainable ones, the ones that have more of a sustainable business plan for the future. And again, through all of it, elevating children's environmental health from the very beginning. Childcare, we have the Eco-Healthy Childcare Program. Again, childcare in the U.S. can serve children anywhere from 6 weeks of age to 5 years before they go to a K through 12 school. That's cognitive learning development right at its height. So unfortunately, we do know that many children, Kitty College, New Jersey, I mean, there have been many that haven't even made to the media where children are getting very ill by just being exposed and just being dropped off in their childcare. 13 million children on average. During the COVID pandemic, this report called Picking Up the Pieces was identified and released, and it just shone a light on what we have already known, but I guess the rest of the public was catching up. Childcare is fragmented. Every state has its own licensing and requirements, so that causes a lot of concern for training. It's inequitable. Again, it's not accessible. Not every child has the benefit of going to any form of childcare. Most childcare are in homes. This is small business, and most of them are run by women of color. So there's many layers of this, and during the COVID pandemic, when childcare had to close, that is a major situation for a family unit. That's a major situation for communities that maybe only have one licensed provider for miles to depend on. So there's a whole ripple effect of support. And they're underfunded. Less than 5% of the gross domestic product goes into childcare. And for public health, I think it's something like under 10%. So again, the writing's on the wall. We have not put the needs of children first, and we certainly, again, are not bridging public health and the data and lived experiences. There have and continue to be more studies showing us that children are being harmed in these environments. Not on purpose, it's just that these providers and the owners don't know any better. They haven't been trained in this way. So our program is working to train and educate with low to no cost childcare professionals, owners, facility managers on steps they can take to promote their work setting as employers and also the children they're serving, and then sharing that the lessons that they take and the steps they take with their parents. We're also part of this movement, Growing Up Healthy. So we're not just keeping our lessons learned of 13 years of our Eco-Healthy Childcare Program in an igloo. We are spreading that with other childcare professionals and other modeled activities. We're trying to change the whole movement of childcare. If we can have a much stronger basis for the learning environment of children, think about the potential when they enter the K through 12 school environment. We're part of the Lead Service Line Collaborative, so we've been working to expedite the replacement of lead service lines in the country for years, working with water municipalities, which are very different. Large municipalities like Boston are very different than smaller ones, so smaller ones function like nonprofits. So we've been learning from each other. We've been having some very robust discussions and trying to get to the point of working, again, in one unified voice so that at the end of the day, community members are benefiting by having the replacement of these notorious old lead service lines that are causing harm to them and their families. We're part of the Cancer-Free Economy Network. We're trying to change the paradigm of how we address cancer in the US and beyond. A good majority of the money from the National Cancer Institute and beyond goes to treatment of cancers. Like I said earlier, childhood cancer rates have been increasing steadily since 1975. That is not genetics. There's something else, there's a range of other things happening there. And we have a report around childhood cancer with our partners and sustainable business partners that show you can have business, you can actually make money, and not on the backs of children and our public and our environment. There are ways to do that in a much more sustainable way, and we don't have to continue to foster the childhood cancer epidemic that we are on. We're part of Clean Water for All. So these major routes of exposures where children are being exposed, we are trying to show up, trying to be that voice, trying to make sure we don't perpetuate the same cycles of harm again and again. And finally, we're the co-chair of the America the Beautiful for All Coalition. This is different for us. This is conservation movement coming together with public health, coming together with tribal, indigenous, justice communities. And the bottom line is we are trying to mobilize with this administration for them to reach their goals of, by 2030, number one, protecting at least 30% of our waters, land, and ocean from environmental pollution and degradation, and also implying a Justice 40 lens, ensuring that at least 40% of those protected areas, which has never been done ever, are benefiting the most marginalized, the most impacted. So those are some of the ways that we are trying to bridge these gaps, trying to work together, trying to model that we can have progress when we put in the hard work of bringing science with lived experience and data together and mobilizing in one voice what we're looking for with our policy leaders together. So we have a children's environmental health movement. We invite you all to it. There's a lot more I didn't talk about, and here are just a few of the motivators of why I get up every day and do this work. These are all our children's environmental health children. 4 of them are mine. So looking forward to the rest of our conversation. Thank you so much.